Hi, I'm Brian Jacobson, one of the associate editors of Gastrointestinal Endoscopy. I'm here with Dr. Phil Schoenfeld from the University of Michigan. We're going to discuss his paper, The Impact of Fair Bowel Preparation on Colonoscopy Utilization and Adenoma Miss Rates in Patients Undergoing Outpatient Colonoscopy. Welcome, Dr. Schoenfeld.
Thank you.
Can you tell us a little bit of background as to what prompted this study?
Well, we recognize that many patients that are referred for colorectal cancer screening with colonoscopy don't have an optimal bowel preparation, that all of the stool isn't cleansed from the colon. And intuitively, we know that we may miss adenomas if stool is retained in the colon. And as time has gone on, more and more research has begun to hint at this. So that led us to try to quantify how often we miss adenomas when the bowel preparation is fair. Not horrible, not completely full of stool, but where there's some stool and liquid retained in the colon. And that's also important because when bowel preparations are fair, we also saw that endoscopists would bring patients back 3 years or 5 years after the colonoscopy instead of the recommended 10 years if it was a normal screening colonoscopy.
So what exactly did you guys do, and then what did you find?
Well, we looked at 3 years of data from our endoscopic database for patients referred for screening colonoscopy. And we quantified how often the patients had a fair bowel prep, and then looked to see what the recommendations were for when those patients should come back for their next colonoscopy, and then looked to see how often adenomas were found when they had that colonoscopy repeated within 3 years.
So
a
when
very
they
short
did
interval.
come back. Right.
Exactly.
Okay.
So specifically what we saw was that among the patients that met the inclusion criteria, that approximately 30% of patients referred for screening colonoscopy had a fair bowel prep. And among those patients, 70% of the time, the endoscopist recommended that the patient come back for a repeat colonoscopy sooner than is consistent with guideline recommendations. And in some ways, that seems quite appropriate because when the patient came back within 3 years, we found that 28% of those patients had adenomas found on their repeat colonoscopy done within 3 years, done at a shorter than expected interval, which implies most likely those adenomas had been missed at the original colonoscopy. So the ultimate bottom line is that it demonstrates getting a fair bowel preparation is associated with a clinically important miss rate for adenomas, and we need to figure out a way to minimize fair bowel preparations.
In your practice, it sounds like everyone's using excellent, good, fair, or poor. Is there a standardized way that they defined fair, or it was just left up to people?
Ultimately, our endoscopic software uses a modification of what's called the Oranchik scale, the excellent, good, fair, poor. And excellent is meant to imply that you have 90 to 95% of the mucosa seen with just minimal clear liquid, that a good prep is 90 to 95% of the colon seen with moderate liquid that has to be suctioned, that a fair bowel prep is less than 90% of the colonic mucosa seen with some retained stool along with the liquid. And anything less than 80% is considered poor or an inadequate prep. Those are the categories that we utilize at our institution.
And so what are the next steps for you and your co-investigators?
Well, we specifically chose to look at our database from approximately 10 years ago because we wanted to look at the quality of bowel preparation before our institution instituted split bowel preparation. Our data, again, comes from when patients took all of their bowel preparation the night before their colonoscopy, and we think that was the main reason why 30% of these patients had only a fair bowel preparation. We have additional research we're doing now that we're utilizing a split dose bowel preparation in everyone, and our preliminary research has clearly shown that the quality of our bowel preparation has improved, that really isn't surprising since multiple RCTs have demonstrated split dose bowel preparation produces more good to excellent preps.
Right, so hopefully fewer that have to come back earlier. Well, thank you very much for spending time with us.
Happy to do it.